The difference between mankind and other species is our ingenuity. Throughout history, we've learned to invent and reinvent for the better. From the way we learn, transact, consume, care, and serve, adversity allows us to transform. Sure, industries will live and die. Life will change, but it beckons us to begin again, to live again. Just open your eyes and see.
Behind every healthcare provider, there are tests, scans, and data used in the care of COVID-19 patients. From the development of an antibody test intended to provide a clear view of a patient's disease progression, to a real-time PCR molecular assay to aid in the diagnosis of the infection from the virus that causes the COVID-19 disease, we're behind you. From CT scanners that help technologists maintain social distance, to ultrasound systems that may reduce transmission risk to others by not moving the patient, we're behind you. From staffing and training to education and real-time service, we're behind you. Because even in these unprecedented times, care is a partnership. And behind every healthcare professional, there are 53,000 Healthineers. Proudly supporting those who are supporting us all.
Good morning. I'm RJ L. Balinbin, your moderator for today's session. Everybody would agree that public health innovation is indeed an important public good. It's an investment that will pay off to protect economies and, first and foremost, lives, as said in a report by the Asian Development Bank. Of course, technology has always played a major role in public health. So for our discussion today on technology's key role in public health innovation, we think of the questions: how has the COVID-19 pandemic pushed our public health institutions and the government to embrace technology and innovation for the health and welfare of the Filipino people? And how can they continue to work together for a better and modernized public health system in the country? To start this conversation, let me introduce our speakers. Our first speaker is a lawyer who has served in both the legislative and executive branches of government. She first represented Makati and Congress in 2007 when she was 31 years old, making her one of the youngest lawmakers in the country. And she served for 2 more terms after winning the 2010 and 2013 elections. In 2016, she won the mayoral race in Makati City. Ladies and gentlemen, Makati City Mayor Marlene Abigail Binay. Good morning, Mayor.
Sorry. Good morning, RJ.
Good morning. Go ahead, ma'am.
Good morning to everybody. Before I begin, I would like to thank the Business World for inviting me to this forum. As a champion of smart and adaptive governance, I believe that the impact of technology in the healthcare sector is crucial to preventing local transmission and mitigating the socioeconomic efforts of a crisis. Besides what is given to us by the national, other than what is given to us by the national government, we have placed an order for 1 million doses of AstraZeneca vaccine for the benefit of our Makatizens. We only have around 600,000 residents, but our daytime population balloons to more than 4 million because of the companies and industries that operate in our city. We wish to extend the same health protection to them because these businesses have consistently supported us in our endeavors. Without their help, we would not enjoy the benefits of being the country's premier financial district. Do I dare say we are COVID-19 proof? Of course not. As we speak, the city continues to battle the second wave of the pandemic. We have two phases for our vaccination plan. The first one, which we have already started, covers our medical frontliners. And as mentioned earlier, healthcare service providers from OSMAC and Makati Health Department are on the priority list, and other essential workers. Phase 2 will cover the general population of our community. However, we are still prioritizing our senior citizens and residents who are considered high risk or with comorbidities. So we have a total of 155,000 senior citizens, and we have a population of 18 to 59 with comorbidities at 14,574. Our indigent population is at 4,161. So we will be targeting around 30,000 medical frontliners from both the public and private. We are more than halfway done in this target. For phase 2, we will be covering the residents and 18 years old and above. And we have already started the online registration for our senior citizens, for our indigent population, and for those with comorbidities. So once we have rolled out the program, we target to finish for the general population 2 to 3 months. And we have projected that with 104 vaccinators, we can vaccinate over almost 11,000 persons per day. So we have all seen and felt the pandemic's debilitating effects of our economy, our work, our families, and our personal lives. As COVID-19 cases continue to rise, we cannot let our guard down, not even for a day. We can only continue to be extra careful and implement mass testing and roll out of the vaccination program as swiftly as possible. The city government of Makati needs everyone's support to make our goal of 100% vaccination rate. And I'm encouraging everyone to please sign up and get your vaccine, so to protect all of us. Vaccination is the best chance for us to beat the coronavirus, and stay safe, and thank you to everyone.
In Makati City. Now, our second speaker is a physician scientist and currently the director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. He is also a clinical assistant professor of the UP College of Medicine's Medical Informatics Unit and is the current president of the Philippine Medical Informatics Society and chair of the Health Informatics for Development Working Group of the International Medical Informatics Association. For his part in the Philippine COVID-19 response, he serves as co-chair of the IATF Sub-Technical Working Group on ICT for Data Governance, where he oversees the direction of the government with regards to ICT adoption, use, and implementation. He is the overall policy lead for the Philippine COVID-19 Vaccine Information Management System and representative of the Department of Information and Communications Technology to the Vaccine Cluster, National Vaccine Operations Center, NTF Response Cluster, Data Management Group of the NTF Intercluster, and the IATF Technical Working Group. Ladies and gentlemen, Dr. Raymond Francis Sarmiento, National Telehealth Center Director. Good morning, Doctor.
Thank you and good morning to everyone. It's a privilege for me to be able to share insights with regards to the impact of technology on healthcare, particularly on how it has impacted our lives, especially now that we are still in quarantine in this pandemic. For the past year, we have been inundated with a lot of information, most of them verified, a lot of them also unverified. So very, very important to note that technology plays a key role in terms of all of these verification of that information. I'd also like to emphasize the value and the meaningful contribution that technology has played in terms of all of our work, in terms of automating all of our testing results, the work that's being done in terms of coordinating the availability of resources and beds all across the country for our isolation facilities and ICU facilities, our digital contact tracing applications as well, and the integration that happens among all of these systems as part of the entire COVID-19 ICT ecosystem. In the past few months, we have been concentrating on elevating our current status in terms of vaccine ICT systems, and we hope to be able to push forward in terms of innovations and how technology will play a crucial role in terms of integrating all of the data so that we could recover as one and heal as one. Thank you so much.
Thank you, Dr. Sarmiento. Now, our third speaker has more than 20 years of experience in corporate marketing and product innovation. He completed Wharton Business School's Executive Development Program and graduated with distinction from the MBA program of De La Salle University Graduate School of Business. He is currently the Vice President and head of the newly created Disruptive Business Group and is responsible for business development and product development of the group's social, mobility, analytics, cloud, and security portfolio. Ladies and gentlemen, Patrick Nico Alcoseba, Vice President and Head of ICT Business of PLDT Enterprise. Good morning, sir.
Good morning, RJ. Good morning to all our viewers. Thank you to Business World for this opportunity to be part of this very meaningful discussion and very relevant discussion. Technology and public health are not often mentioned in the same breath, and yet technology adoption and economic growth have become more correlated since technology has the power to multiply benefits across the entire ecosystem. And health tech is a growing area of importance across the globe since managing the health of the nation has become very intertwined with managing the health of its economy. And there are a number of foundational aspects to health tech, but what can really make the biggest positive impact would be technologies that can enhance the capability of patients, doctors, healthcare providers, and other institutions to connect and communicate, and also technologies that can multiply limited resources across geographies. Many examples have appeared in the last year: internet networks, contact center solutions, other vertical apps such as contact tracing platforms, and of course, platforms such as telemedicine and telehealth, which really allowed for a lot of efficiency and productivity when it was put to good use. In the very early stages of the pandemic last year, PLDT worked very closely with government institutions such as the UPPGH and the DOH to set up COVID hotlines that helped with patient triage and other automated workflows and processes. Our affiliate Multisys, meanwhile, is also the creator of StaySafe.ph, which today is used to help automate contact tracing, a component of virus management that has been seen as very critical in other countries. Moreover, there also has been a wave of telemedicine and telehealth platforms that have entered the Philippine market to help connect patients, doctors, and medical institutions to allow healthcare to continue and even multiply during these travel-restricted times. These platforms can especially help the barangay health centers who can share a pool of doctors, enabling more of the citizenry to have access to healthcare. In parallel to all these developments, the PLDT Group has continued to invest in enhancing and expanding our networks to ensure an internet experience that enables the digital health ecosystem. And we will continue working with the public sector to ensure that connectivity is democratized even more and reaches a wider section of the population. I'm very excited for the discussion today and looking forward to a healthy conversation. Thank you.
Thank you, Mr. Alcoseva. Now, our fourth speaker is a tech entrepreneur who has founded many startups over the years and is an advocate of innovation from the grassroots. He is currently the co-founder and CEO of digital health startup Medify, founder and CEO of Agile Development Shop, Proud Cloud, and the founder and CEO of Launch Garage, an innovation hub based in Manila. Ladies and gentlemen, Jay Fajardo, CEO and co-founder of Medify. Hi,
Good
Sir Jay.
morning.
Good morning.
Yeah, good morning. Thanks, RJ, and thank you, Business World, for inviting me to be part of this panel and to participate in this very timely and significant theme. Um, I'd like to share what I'm doing now with this product that we have called Medify. So let me share the application. Okay. So Medify is a very straightforward platform that we've built over the past couple of years. And it has a very specific objective, um, connecting physicians with their patients remotely. So our interface, if you actually are a user of Medify, the path and the user's path is very simple. It allows you to find a doctor through our doctor search facility, or to consult now directly with doctors that are waiting and online on the platform. Um, Once you've selected a doctor, or once a doctor has actually connected with you, you get into a chat first interface, and you're able to conduct a teleconsultation using chat. And of course, you're able to jump onto an audio video call anytime it's required by the doctor. Um, After a consultation, the normal result is, after resolution, is a prescription, lab request, or medical certificate. And we've just recently launched a service where um, our partners are able to deliver medicines directly to your homes nationwide. And for Metro Manila patients, they're able to request for a lab visit directly to their homes for the typical blood extraction, etc. This is a view of what the doctor sees on the other side when they do a teleconsultation. Um, just like the mobile app, they're able to enter into a chat with their patient and jump onto a video call whenever it's required. When we started Medify in 2015, we really set out to try to help the prevailing problems that the Philippines experiences with regards to healthcare, particularly access to doctors. And as you may know, the ratio of doctors to patients in our country is very low, and we see Medify as a huge force multiplier and reach multiplier for physicians and their patients. Last year in March, our platform became played a heightened role because of the quarantine. Not only were patients uh, having a hard time going to their clinics because of the quarantine, but doctors themselves were looking for a way to continue their practice. That's why Medify suddenly exploded in the past 12 months, and we've been able to serve not just in Metro Manila but nationwide consultations remotely, and even abroad, Filipinos from abroad consulting with the local doctors here in the Philippines using our platform. I think what's significant today as well is the ability for Medify to try to serve a triage role. Even before the pandemic, studies have shown that about 70% of visits to healthcare centers were avoidable and could have been resolved or triaged outside of an already congested healthcare system. And I think because of everybody knows that we're experiencing a lot of pressure on our healthcare system today, and we hope to help alleviate this pressure on hospitals and emergency rooms, etc. So that's it. Thank you.
Thank you. Thank you, Mr. Fajardo. Now let's have all our speakers back on screen for our Q&A. Hi, everyone. So to start this conversation, let's have some background for our viewers. How would you describe the country's public health sector before the pandemic hit our country last year. Did you see technology already becoming much more involved in the public health sector? I think I would like to hear first from the Makati City Mayor, Mayor Binay. How was it before the pandemic?
Well, even before the pandemic, we already saw the need. Actually, I was already doing inquiries for telemedicine to address the issue of the city's scarce resource of doctors. So even before the COVID-19, we were considering already the use of telemedicine. I think one thing that's crucial for any LGU now that is engaging in a vaccination rollout is their database. How many senior citizens do they have? How many people do they have that have comorbidities? I think very crucial. Technology will play a very crucial role in analyzing the available data that they have. So as far as the city is concerned, we are using that now for our vaccination program. So going back to your question, prior to COVID-19, we sought the need. I felt the need for a telemedicine. We are currently already establishing our health info management system, which was supposed to be started prior to COVID-19, but we are forced to expedite the use of our health info management system.
So, Mayor, can you say that you were some sort of, ready for the transition when pandemic came?
Not really, not a little bit ready maybe, but not as ready as we would have wanted. We were already starting to procure the equipment. We've already purchased our scanners, our computers to be able to digitize our health records. But again, because of COVID-19, things had to take a backseat because we had to focus on addressing the issues of the health issues of our citizens. So in a way, maybe a little bit prepared using technology, but not as much as I've wanted. I guess that's the right answer. I would have wanted to be more prepared using the technology.
All right. So, what about the other speakers? Dr. Sarmiento, what was your observation before?
So observation, it was, well, to be honest, it was slow moving. We had been in the space, not just in telemedicine or telehealth, but the entire e-health space. As for the National Telehealth Center, we are celebrating our 23rd year this year. So that's how long we have been working in the space already. It only picked up, I think, in the last 5 to 7 years, I believe, in terms of digital health governance, the entire enterprise architecture revolving around digital health, program management at a national scale, the pushing forward of standards and the need for interoperability. For the past half decade, that has been what has been the focus of the country as we move towards reaching the ideal of the Philippine Health Information Exchange. RA 11223, or the Universal Healthcare Law of 2019, I believe it has been very, very helpful in terms of moving that forward. But the pandemic has brought about challenges. But that is not to say that we have been idle on the public health innovation, health information technology front. On the other hand, we have been looking for ways on how to elevate, let's say, our telemedicine practices. So the National Telehealth Center has worked with the Department of Health in issuing telemedicine practice guidelines. We have also been working with several different entities, DICT, DOH, the DOST, etc., DILG, obviously, working towards having a unified approach in all of our efforts. So both good and bad, we have been working towards improving all of our efforts. But really, there's still so much more work to do. and we just really excited to just get out of this pandemic and move forward with our implementation using a service delivery network approach for a digital health aided universal healthcare.
All right, sir. Mr. Fajardo, you would like to add something?
Sure. Yeah, before the pandemic, it was quite difficult to convince physicians, for example, to jump onto a telehealth platform such as ours. And it was very understandable because we found that physicians are very worried about adding any kind of new technology to their practice because of the increase in possible risk. But when the quarantine happened in March last year, that's when the motivation to get on our platform became very clear for them. And we grew the physician count from about 425 on our platform to today we have about 3,000 plus physicians on our platform from across the country, and serving about 37,000 patients now. So from 300 patients. So it was if it was very difficult before the pandemic to try to get usage and traction onto the platform, the environment and the times just dictated the need for it, and people started getting on it and are continuously using it. It's still early days for us. We know that the traction was strong in Metro Manila and the environs, but we have been seeing some traction out of Visayas and Mindanao already, using the platform. We're B2C, so we're not your typical telehealth workflow where it's institution based. We are a platform. We reduce the friction point between the patients meeting the doctors, and we just serve as the connector for them both, and then they can head on and do a teleconsult.
What about the doctors, sir? Is it easier now to get them on board?
Yeah, definitely. In fact, we didn't have to market to them. They themselves, networks of doctors, actually reached out on precisely right after the announcement of the quarantine last year, March 16. They started reaching out and started coming on board.
All right. Okay, Mr. Alcosaba, you have anything to say, sir?
Yeah, well, I think I share a consistent experience with our other panelists. One thing I would like to add, I think what this experience has done for us is it changed habits. It really changed ways of doing things. If before, maybe patients would not be as open to doing a video consult, they would very, very much prefer to do it in clinic. Today, those habits have changed, and I think it's part of a bigger change. We see that video and connectivity has become hygiene, and we're trying to make sure that the PLDT group, including Smart, is part of that ecosystem that helps our country really move forward from this experience. One thing we've noticed is that if you're a senior citizen parent, for example, I'm sure all of us have had that experience where these are the most technology resistant, I guess, of all our population, but they have become very much more comfortable with technology, with using video calling, with using apps, with using delivery apps. And so that has translated into the other ways they do things. I think the critical portion of this would be if we have critical care patients, chronic disease patients who can be served even by telemedicine. Today, a lot of the telemedicine that we do is mainly outpatient, which I guess is the higher volume and very important. I myself, I'm a heavy user of telemedicine.
It's interesting that you mentioned our senior citizens now are becoming much more involved in technology and telemedicine. All right. My second question is, how are technologies actually such as telemedicine and telehealth further utilized in responding to the COVID-19 pandemic and attending to its effects? just a scenario. How was it? I think Mr. Fajardo has something to say to this.
Okay. Well, the role that we play really in this crisis is as an alternative to going to the hospital. And it's for a lot of over the past 12 months we've become the alternate solution for access to healthcare to doctors without having to go to a clinic or the ER, and to again to practice social distancing, etc. Unnecessary exposure. Um, so that was the most that we did in the past 12 months. However, when now that the numbers have started to rise, we have seen a lot of requests for um, for care, for access to pulmonary doctors, access to GPs, and most of these requests seem to revolve around the fear that they themselves are already infected. So maybe for in that use case, we're sort of like the first encounter with a doctor, just to find out, for the peace of mind, and then obviously the doctor will give them instructions to undergo their testing, etc., and to confirm whether or not they're positive, and then seek out proper care for that for COVID.
All right. Thank you. What about Dr. Sarmiento? What's your observation, sir?
So for the pandemic, it has been, I think the numbers that we got, at least for the metropolitan cities, there has been an increase in terms of it has been around an 80% turnaround, at least for the metropolitan cities, with regards to their shift into a digitally aided telemedicine consultation or telemedicine environment. Although not all of them have completely shifted to a purely telemedicine consultation, just because there are certain nuances, certain conditions that really require face-to-face consultation. For the most part, providers have done a hybrid approach wherein they dedicate a specific amount of time per week for seeing patients through telemedicine, and then the other part will be for seeing patients that really require a face-to-face consultation. It has you would imagine it has increased the number of players in the market. It also has put into focus the need for a unifying national legislation that will be part of the guidance in terms of the regulatory framework in and around telehealth or telemedicine. That's something that we are working on with the Committee on Health at the House of Representatives, and because of the substitute bill, and with also the Senate Committee on Health with Senator Mongo.
All right. So, sir, is this the same experience we have with the public hospitals? Are there really government doctors serving those who cannot really afford private care?
So at least for PGH, let me share that the PGH has been offering telemedicine services for the most part of the pandemic, just to be able to still provide services while protecting themselves, ensuring that safety is still number one priority for our healthcare providers. A lot of the services have been, with PGH being declared as a COVID-19 referral hospital, there was really a need to streamline all of the services and also at the same time not ignoring or still taking care of and putting the appropriate focus in terms of the non-COVID cases that still continue to rise. So we are right now, and I'm sure all of our panelists know this, we are at a dual threshold in terms of the rising number of COVID cases, and also perhaps a non-attendance or a weak attendance in terms of providing services for our non-COVID cases. So that's something that we need to be able to address. And given that our healthcare system is getting overwhelmed, there really is a push for expanding a lot of our resources, maybe creating makeshift hospitals, maybe converting a whole lot of our available spaces for isolation facilities. So all of that gets into the table just so it gets, if you look at it as some sort of a puzzle, if you move one piece, then it moves the other pieces around. So that will be helpful in terms of the entire picture.
Thanks, Dr. Sarmiento. No, Mayor Abby, what's being done in Makati with all these technologies?
Similar to PGH, we started last year the telemed for our outpatients in Hospital ng Makati. So that was to encourage people to still have themselves checked even during the period of the pandemic. I think we failed to realize that we are so focused on COVID patients that we still have to address our non-COVID patients, those that undergo dialysis, those that have cancer that needs to undergo chemotherapy, those that have illnesses that require frequent visits to the outpatient ward. So those are similar to PGH. We also established telemedicine for our outpatient department.
What about contact tracing technologies, ma'am? Are there any that you are? Yes.
So for the contact tracing, one, we established our own organic platform for our contact tracing. We have a dashboard that the city epidemiology uses. We also have a QR code that is similar to Safe Philippines, the QR code pass that will eventually be integrated with our vaccination program. So, for example, if I have a QR code, the same QR code will also contain my vaccination details, meaning if I've already had my first dose or if I've already had my second dose. So this is in preparation for the possibility that other countries or our country will require what they call a immunization passport. So we've also developed a QR code that coincides with for the contact tracing as well as for the vaccination program.
Okay, but realistically speaking, to what extent does this contact tracing application really help?
Again, it really depends. It boils down to implementation. Do they use the QR code when they go to the establishment? The contact tracing tool, it's just a tool that the CESU uses to be able to ensure or refresh the mind of a person that's actually COVID positive, because there's a lot that they forget. They wouldn't remember they went to this place, but actually the app or the QR code can refresh their memory. Not necessarily be able to detect their close contacts, but where they've been, and then to get more information from the establishment where they were. So it's just a tool. It doesn't make it foolproof when you do have a contact tracing app, but it just helps the CESU to refresh the memory of a person who is COVID positive.
Okay, I asked that because we heard from news that we are not doing very well in that aspect. So what could have been done?
The thing is, you have to remember that the WHO has certain standards. I think it's 1:800, meaning one contact tracer for 800 population. I have a population of 600,000. I cannot hire that many people just to do contact tracing. That's not logistically possible. Quezon City cannot afford that. Manila cannot afford that. As discussed yesterday, if you are there is a a protocol also as 1:37, meaning you're supposed to be able to trace up to 37 people that they have contacted. But unfortunately, not everybody are as they don't, like, for example, if I'm single and I work in an office, I go to the office and I go home, I live in a condo. So I don't think you, and with the amount of protocols wherein you limit the number of people you interact with, the 37 is kind of too high. So again, the benchmarks are not applicable for everybody because not everybody are similarly situated.
All right. So, anyone else would like to add to that? What else can be done to improve our contact tracing capacity?
Can I take a stab at that,
Sure,
RJ?
sure, sure.
So what will be important is that so I think we have been pushing for, obviously we have an endorsed contact tracing application for government offices also, but a lot of the work also that has been done to date by the local government units has been the development of their own contact tracing applications and protocols. I think what gets missed and overlooked, if I may, is the fact that a lot of all of these works have to be integrated. The integration of the data that's being collected by one application in one city, maybe in Luzon, another one in Visayas, another one in Mindanao. If we are able to set up a centralized contact tracing data warehouse that will be connected to the national laboratory data results repository, that would be very, very helpful in terms of taking care of all of our information that needs to be accessed at that point of entry in facilities, those things that need to be accessed in terms of aiding all our yung mga in-person po na mga contact tracers, also those that need to do our case management. So as long as technology is there, and if we are able to integrate all of this information, so let's say one from Stay Safe, the one from Pasig Pass, maybe Valtrace, and all other contact tracing applications, I think we will move forward in terms of being able to quickly and more efficiently identify all of these potential sources of infection.
Thank you, Dr. Sarmiento. Now, we will take a question from our audience. How do you address issues or concerns in terms of accuracy of diagnosis using video consultations? Are there safety measures already in place? I would like to take this. Mr. Alcoseba? Anything?
I would defer to the owners of the telemedicine platform.
I
I can answer that.
Mr. Fajardo.
Yeah. It's actually the responsibility of the doctor themselves to complete or resolve the diagnosis. So, meaning, if they are unsure, I don't want to how do you call this, preempt their ways of doing things, but some of the cases where they cannot make an outright diagnosis right away, I see them requesting for lab tests, and this is something that seems to be a very important component of any resolution for serious cases. That said, though, we have seen a lot of resolution of cases even without video calls. As you may remember, I said that our first contact is really a chat, and we have seen consultations start and finish within 12 to 15 minutes purely on chat. And there are apparently there are consultations that can be addressed that way. We have also seen one of the popular practices that is on Medify is dermatology, and aside from the audio video consultation, they also utilize the phone camera to take photos of any kind of condition, and maybe a skin condition, whatever. And the dermatologists are able to make concluding or a concluded consultation based on that. So yeah, it really depends. It depends on the severity. I'm pretty sure that if there's something that they cannot resolve right away, they immediately refer to a physical visit to a clinic,
All right.
which again is something that we only complement, we don't replace.
All right, thank you, Mr. Fajado. No, of course, this remote care won't work without connectivity. So now we have Mr. Alcoseva to answer this question from our audience. How soon do you see 5G technology impacting telehealth in the Philippines?
Thank you for the question. I think it's a very exciting field. In fact, it's one of the major investment areas of PLDT and Smart for the medium term. Maybe to explain in layman's terms, what 5G enables would really be two things. One, much higher bandwidth, and number two, much lower latency. So it's really a performance technology. And the way we see it, based on initial tests we've run with our market, there are really four industries that can benefit from it. So that would be manufacturing, public sector, especially for smart cities. Number three would be healthcare, and of course, learning. Now focusing on telehealth, we've seen in our networks that we already have 1 million 5G enabled devices. So some of those may have already been used for a teleconsult. And owing to the question a while ago, very important in a teleconsult would really be the accuracy and the resolution of what the doctors can see, especially in a physical consultation. But I think beyond that, a more advanced use case that we see in more developed economies would really be remote operations. I think we've seen these videos already a few years back where an operation is being done somewhere in location A, where the actual specialist is in another location. So 5G can enable a more accurate and can enable a more experiential way of doing this and make it more feasible for the country.
I believe PLDT is also developing its own telehealth applications, or what you call telehealth platforms. Any update on that, sir?
In terms of telehealth applications and telehealth platforms, we do partner. A big portion of what we want to do in our telehealth or e-health drive is to provide the enabling infrastructure to make telehealth possible and very viable, to make it more wide scale and to make it more democratized. We do have sister companies such as our MPIC, our Metro Pacific Investment Corporation conglomerate, where our hospitals and our healthcare specialists are. So we work very closely with them to make sure we develop a solution that can be used by a wide scale of our country and of patients.
All right. Thank you, sir. Now, of course, all these require collaboration between sectors. So collaboration between sectors was highlighted in responding to the pandemic. When it comes to applying technology to health, how do we assess now the collaboration between the private and the public sectors? Was there enough collaboration? Were there barriers or what? Yes, Mayor Binay, any observation? How is Makati collaborating with its private sectors in the city?
Well, as you know, the city entered into a PPP as early as 2016 to establish our internet connection. So we're able to provide free internet for the entire city except for those in the villages. So we have a very stable internet connection. So that was one infrastructure that I had to ensure that was ready as early as 2017. So that was in we have a PPP partner for that. So With the backbone of the fiber optics, we are able to lay the ground for all other IoTs that we will eventually use, integrating our systems, integrating our CCTV cameras, integrating our healthcare centers. This is all pursuant to a smart city, and part of a smart city is the health sector. So, good thing we were able to prioritize our fiber optics as early as 2017.
So what's your timeline for that smart city, ma'am? When is it going to be 100%
It's
visible?
it's ongoing. We are already a smart city, but there are still a lot of innovations that we want to introduce. We also have our Makati Zen card and our app that we also introduced in 2017. So even the Makati Zen card helped us to be able to give economic relief to over 200,000 people, cashless during the pandemic. There were no lines. We were able to do it by a click of a button. So those are technological innovations that we introduced that needed foresight. It was
Mm.
not something that we were doing because we thought of there was a pandemic coming in 2020. All these technologies that we introduced, we were able to do it. We were able to provide services during the pandemic because it was established way 3 years prior to the pandemic. That's the reason why we were able to do it.
All right. Thank you. Yes, Dr. Sarmiento.
So in terms of private-public partnership, the Department of Health has also been getting to know a lot of our telemedicine providers through a telemedicine regulatory sandbox initiative during the early part of the pandemic. Right now, as part of our efforts, we have been closely working with the T3 consortium. A lot of the efforts have been really coordinated, just so with the understanding, of course, that it's not the onus is not only on the government or on the academe or just the private sector. It really requires a fully coordinated approach together with the civil society organizations, etc., for us to be able to address a lot of the problems that we are facing right now. We at the National Telehealth Center, we envision and anticipate that this public-private partnership will continue to much more proliferate and essentially be more of a mainstream mechanism for us to be able to deploy and implement digital health programs in the country, not just during this pandemic, but even more so after the pandemic.
All right. Thank you, sir. Thank you, Dr. Sarmiento. Now, related to that, are there regulatory barriers that Mr. Fajardo sees that both the private and the public sector need to address? Sir?
Barriers. So far, there are none. We've noticed that the government has been very open, particularly in the past year, to embracing technology, embracing telehealth as a going concern, as a way to consult. I guess the closest I can think of is establishing privacy policies, for example. I know that that there are bills being sponsored in Congress that are actually defining all these already, and we're really looking forward to that. But right now, we haven't seen any real barriers that the public sector has put up, or even unknowingly preventing innovators in the space to continue doing what we're doing. So far we're okay. I don't know in the next couple of years, but right now we're fine.
All right. Thank you, Mr. Fahad. Now, Mr. Sarmiento, I think he needs to log out at 12:05. But I'd like to hear a final message from Dr. Sarmiento before he leaves.
Thank you, RJ, and thank you for being given this opportunity to be part of this excellent panel. Part of the work that we are doing at the National Telehealth Center will be to empower not just communities, but also our academic partners, our collaborators from the private sector, and most especially those strengthening our partnership with the Department of Health and all other government agencies and instrumentalities to push forward our digital health agenda. There are four pillars that we are working on: strengthening our digital health governance, establishing our health enterprise architecture, positioning our project management office for digital health as through a centralized effort, and then finally advocating and promoting and implementing standards in interoperability in the country. The National Telehealth Center has been working towards the establishment of all of these registries, national registries, all for the most part, all of these hospital information systems, electronic medical records, laboratory information systems. But more importantly, there is a need right now, just because of there's a proliferation of siloed solutions, to integrate and have them be interoperable with each other. And we hope that's something that we will be able to see to it as a reality very, very soon as we move towards implementation of the universal healthcare law. Maraming salamat po.
Thank you. Thank you very much, Dr. Sarmiento. All right. Now, for the sector that provides connectivity, as Mr. Alcosaba, sir, are there regulatory barriers that you think the government or even the private sector should address in order for our connectivity to further improve?
Well, I think the government has been very supportive, especially with the latest CREATE law. There's a new STIPP, which also gives incentives to technology investments. So it helps spur not only PLDT, but I think the entire technology ecosystem. So connectivity, we can expect, can grow faster, can grow wider. And the other applications, the other integrations that Dr. Sarmiento had mentioned a while ago can probably also happen quicker. And we're very excited to see that in the next 2 years, we can really scale this and make telehealth and telemedicine a practice that can be widely used by more of our citizenry.
All right. Thank you. Thank you, Mr. Alcosaba. And now a very important question that I think everyone should address in terms of the digital divide. How are we going to address this? Since we are now speaking of remote care, how are we going to address this issue on digital divide? What's being done in Makati City, ma'am? Mayor Binay.
Are you saying digital divides
Yes, correct.
A computer?
Healthcare. Access to healthcare.
Because of the lack of a
Correct.
a device.
Yes.
Correct?
Yes.
Because as far as internet is concerned, we already provide free internet for our Makati residents. So that's not an issue anymore. So the only issue will be the hardware. Either it be the cell phone, the tablet, or the computer. All our barangays have a computer. Even during the pandemic, we established what we call Jeepney Maki for our students that have difficulty for the online classes or the modules for our students. Now, I've also instructed the Jeepney Maki has a computer and has also internet access. So as far as healthcare or even as far as vaccination registration, we are making these computers available for everybody in the barangay. So and again, your cell phone, everybody has a cell phone. I don't believe that there is anyone that does not have a cell phone. And you have a relative that has a smartphone. You have a daughter, a son, a pamangkin that has that if you're a senior citizen not that is not very tech savvy, but you have to adapt for you to be able to get your ayuda, for you to be able to get your social pension, for you to be able to get any economic relief, because now we do it cashless. So those are things that we are already providing. We were waiting for a delivery of tablets for our University of Makati students. It's supposed to arrive this year. We will be also distributing. So as far as the city is concerned, I don't think there is such an issue as far as equipment or digital divide.
All right. Thank you. For Medify, Mr. Fajardo, what can be done for our remote areas?
Okay. Well, let's to put into context the experience in the healthcare divide, actually, which is the most important thing. NCR. Remember, I showed 6 doctors for every 10,000 patients, average in the entire country. NCR actually experiences a high ratio. There's 10 doctors for every 10,000 patients, which is supposed to be okay. The average across the countryside is about 2.5 to 2.8 doctors for every 10,000 patients. That is the one that has to be addressed. That's what, and unfortunately, the countryside is also where we lack connectivity. Mayor Abby is correct. Device is not an issue. Penetration of devices is very high in the Philippines. I think first and foremost would be the connectivity for bandwidth. That is the first thing that we have to address. The second one is, if we cannot roll it out fast enough, is to identify exactly like what they do in Makati, the Jeepney Maki approach, is to bring the connectivity to them in creative ways, whether it's a mobile one like that, or in community centers, for example, barangay centers, sari-sari stores, etc. Start there, and then we cannot. It's not I'm sure the telcos know this. They cannot. There's so many things that have to be solved to have blanket coverage. It's not going to happen in the next in the near term. So we have to look for creative ways based on our own cultural nuances and how it is in the ground to deliver bandwidth and connectivity as best as possible. That's the only way to address the so-called digital divide. It's not just in healthcare; it's also in education, as we experience.
I think Mr. Alcosaba can react to that, sir.
Yes, and I think we do agree. We play a very big portion in how we can digitally enable not only the healthcare industry, but other industries that rely on connectivity to deliver services. Their most recent CapEx guidance for 2021 was, I think, around 90 billion pesos for PLDT. But Mr. Fajardo is very correct. It's not just about how much we invest, but what other initiatives we do. And I'd just like to share that one thing that does not get a lot of press is that the way for us to improve connectivity or access, the speed to access content, is not just to build bigger highways toward that content. A big impact can also happen if we have that content hosted locally. And that's the other track that PLDT is doing. It's speaking to these content providers globally and inviting them to localize their content in the country, which will speed up access to their content and make the experience much better for a wider section of the population. In parallel to that, of course, would be the expansion of all our networks, whether it's 4G, LTE, or 5G, into the areas that would need it most. So it's something that's ongoing, and it's something that we believe can make an impact. So it's both the investment in the network rollout, as well as in ensuring that the content being accessed is also localized and secured in our data centers.
All right. Thank you, Mr. Alcosaba. Now, to end this discussion, um, we would like to hear your closing statements. Let's start with Mr. Fajardo, to be followed by Mr. Alcosaba, and then Mayor Binay. Sir, Mr.
Okay.
Fajardo.
Yeah. I guess it's following through with the last theme. No? It's not. There's no silver bullet when it comes to delivering technology or innovating, using technology for innovation. There are different ways to do things on the ground. Just to give everybody an idea, telehealth actually happens. 80% of telehealth happens asynchronously, meaning it's not real time. It's somebody sending a message and then the doctor responding at their convenience, and the consultation happening over a long period of time. Um, the idea that telehealth is a one-to-one interaction is not real. It's actually, and that impacts well on the need to have good bandwidth. No, so we have to recognize those real world situations to be able to effectively deliver technology and innovation in with the problems that we're currently experiencing now.
Thank you, Mr. Fajardo. Mr. Alcosaba.
Yes, I have to dovetail to that. I definitely agree. I think one thing that we have to realize also about technology is that, yes, it has the ability to multiply and amplify. However, it multiplies and amplifies both the good and the defects of any system it's injected in, or any process it's injected in. So what's really critical, as Jay had mentioned a while ago, is understanding the pain points. So what's important is that all these health technology platforms will really benefit if we have proper planning, understanding of pain points, needs, and goals, which can be unique to each organization, whether it's a public organization or a private organization, so that the appropriate solution can be recommended and invested in. In doing this, I think it's really important for all of us also to seek partnerships. And the right partners would be those partners who would ask the correct questions and provide valuable insights into what can be changed and maybe done better. Because in the end, I think that's really the shift that needs to happen. When we think of innovation, it's not just about innovation in technology we use, but more importantly, maybe in mindsets we have and in the other ways that we do things. So yes, I really encourage the audience and all the viewers to take a look at technology as an amplifier, but more important would be to understand what pain point, what job do we want to do, so that we can invest in the proper technologies and the proper processes and changes that we need to do.
Thank you, Mr. Alcosaba. Now, Makati City Mayor Binay.
I think I will summarize the statements of all our panelists today. Prior to COVID-19, there was really a hesitation towards the use of innovation or technology as far as public health is concerned, coming from a personal perspective. People were not very open to the idea of going high tech or even telemedicine prior to COVID-19. But it seems to be that COVID-19 has catapulted the need to embrace technology because of our public health issues. And here comes the collaboration between the public and the private sector. As a call out to all our citizens, I think we need to embrace that there really is a need towards public health innovation. There is a need to embrace technology in general. There are senior citizens that are very hesitant in embracing technology, but because of the pandemic, all of us are forced to embrace technology, because without technology, we will not be able, the government will not be able to provide, the healthcare sector will not be able to provide the services that's greatly needed now because of the issues of less physical contact with your patient, between the patient and the doctor. So that's where technology comes in. So hopefully, Let us all embrace technology because this is supposed to make our lives easier, not harder. So let us not be afraid of embracing technology.
All right. Thank you. Thank you, Mayor Binay, Dr. Sarmiento, Mr. Alcosava, and Mr. Fajardo. And to our sponsors, of course, PLDT Enterprise, Siemens, Healthineers Philippines, to our partner organizations, British Chamber of Commerce and Industry, Management Association of the Philippines, Philippine Chamber of Commerce and Industry, and Pharmaceutical and Healthcare Association of the Philippines. And of course, our media partner, the Philippine Star, and to everyone who joined today's discussion. Follow Business World's social media pages to be updated for our next projects. This is RJ Balinbin, and this has been the Business World Insights. Stay safe and stay healthy. Good afternoon, everyone.